Dr. Theresa Tam is Canada's Chief Public Health Officer, and she joins us now. Dr. Tam, the Centre for Disease Control in the United States says it's not a matter of if, but when COVID-19, the coronavirus, becomes a global pandemic. What is your take on that?
Well, right now, Canada is doing very well still in identifying cases in travelers and managing the close contacts with a lot of work from public health. But I think that it is very important for us to prepare for potential onward transmission and spread within Canada.
You said the signs are concerning. They mean that the window of opportunity for containment, that is for stopping the global spread of the virus, is closing. Elaborate on that. What does that mean?
Well, I think all eyes have been on China, which is the epicenter of the outbreak. But outside of China, there's now increasing number of countries where they're reporting sizable outbreaks and where there's some ongoing community transmission, which tells me that the virus is spreading in different regions of the world. These countries are still going to have a go in trying to stop the spread. But I think that right now, this opportunity for us is to use it as wisely as possible to get prepared for any eventual scenarios.
Okay, well, let's say it becomes a global pandemic because it's in Italy, it's in South Korea. As you say, the number of countries are growing. Is Canada prepared for a global pandemic? What do we do differently than now?
Well, we've had quite a lot of experience already, and we have pandemic preparedness plans and response plans at the sort of system, or health system level. So that means looking at our existing surveillance system. We talked about influenza. We use similar surveillance systems for respiratory illnesses and viruses, and laboratories. We got the diagnostic test. We need to be able to sort of spread it out so that there's more capacity in Canada. Most importantly, though, the health system needs to depend on its foundational infection prevention control measures. But when there's a lot of patients, like sometimes in a bad flu season, you need to prioritize your resources. You need to look at business continuity. So the health system needs to prepare from that perspective long-term care facilities, given that a number of the patients who are seriously ill are more likely to be the older age group.
But should we recalibrate what's happening at the borders? Like, should we think of, if it's a pandemic, do we close borders? Do we shut things down like other countries are doing?
It may be sort of anti-intuitive for people to understand this, but the more countries that are impacted means that your border measures are going to be much less effective and definitely not feasible. So we are sort of essentially focusing on general messaging to all travelers. Particularly if you're going to countries impacted by the coronavirus, but in general, you need to prepare before you travel, during, and definitely when you come back, monitor your symptoms.
But prepare how? Like someone is saying, okay, so someone says, well, if it's a pandemic, prepare. I read things online, people said, I've got to get water, 72 hours of water, I better get masks. Should Canadians start thinking about buying masks or the ones that actually work if they do work?
Well, there's some general aspects of preventing yourself from getting sick, and we all know what those are, right? So avoiding people with illness, but when you're sick, definitely stay at home, cover your cough, wash your hands a lot, and we can't repeat that too frequently. But at home, let's just think about this. If someone is sick, know how to prepare to look after someone who is sick while preventing yourself from getting sick through hand washing, through cleaning of surfaces, 1 part bleach, 9-part water. That's the trick in cleaning your home surfaces. Make sure you have supplies. Cover your cough. For that, you need tissues. You need to discard things properly. You can actually distance yourself from someone who's sick. You don't necessarily have to equip yourself and stock up on all sorts of, personal protective equipment, but there's simple things you can do.
But if someone's taking a plane, let's say it's March break coming up, are you advising people to wear a mask, and are those masks in any way effective in stopping the coronavirus?
So I think we are advising people not to just generally walk about wearing masks. That's not going to be effective. But if you're sick, say someone who is experiencing symptoms, putting a mask on a sick person to prevent the transmission from the sick person is a smart thing to do. But otherwise, again, all those other measures to keep, hand washing and everything else. But the other things that you just talked about, being prepared to stock up on your medications, even when you're traveling, but certainly when you're at home, if you have underlying medical conditions. knowing who to call should you get sick, your social networks, looking after your parents or your grandparents and others. So make sure you know how to have all those arrangements, but work arrangements too. So if workplaces are disrupted because of illness, they need business continuity plans. Well, there are ways to work, telework arrangements, but trying to keep people at home if they're sick is very important to keep the virus from workplaces.
Dr. Tam, I really appreciate you joining us. Thank you.
Thank you.